Are you looking for a podcast where you can hear from real people regarding their real dental drama? If so, then you've come to the right place. Join hosts Bethany Petty and Dr. Rena Kuba as we dive into the solutions we've created and the mistakes we've made while managing dental drama. Let's get started.
All right, Dr. Michael, you made it to managing dental drama. How do you feel about this?
Nervous, I guess. I've never been one for words, so
well, to be fair, you got put up to this by one of your lovely bosses, Dr. Kuba, the co-host of this, and you didn't really have a choice, did you?
No, not at all. My work mother told me to, and now I'm here. So
you said, yes, ma'am. I shall do it.
I will comply.
No, I am really excited, though, because you are the first associate dentist that I've had on the podcast. So I think you're going to shed some light here, not only for associates that listen to the podcast, but also for dentists that have associates. So I'm really excited to have you here, even though I know you're not.
We'll see. We'll see if anybody gains anything out of this.
Yeah, it's going to be one of the best. Top 10, no doubt.
All right, let's get on with it. Let's just go.
Okay, so one of my first questions is, I actually spoke with you before you signed on the dotted line with any of your associates right out of residency. And I was very impressed because you had a very clear thought process of what you wanted. Can you tell us, as you were kind of getting out of your residency program, what was your strategy on your associate path?
I think for me, I've born and raised Dallas area. I've never left Dallas. Basically, I knew I wanted to do something in the area. And then in residency, you go and shadow people and, this and that. And I didn't know anything about anything coming out of residency. I moonlit for at 2 different offices in residency. So I kind of knew what it was like to work in the real world. But that was, Saturdays every now and then. So anyway, I was just hey, I don't know anything. Let me just work multiple offices, I guess, and then kind of get an idea of what I like, what I don't like, insurance stuff, and all that kind of stuff. So that was kind of my plan-ish.
Yeah. But I do feel like it was a very clearly thought out, I don't necessarily know what I want, so I'm going to experience different offices to begin to understand what I want. And I do think that's a different strategy. Most graduate from their programs and they're like, I think I know exactly what I want. This is where I'm gunning to get a job at, and we're going to go from there. And I would say, not to speak for you, but I feel like you've definitely developed an idea of what you like and what you don't like in the couple years that you've been doing this.
Yeah, for sure. Because I like I said, I looked at all the pluses and it took me, how long has it been now? 2.5 years.
2.5 years.
Probably a year and a half to that second year out. I knew oh, I don't like this about this office. I hate this. I really like this about this office. That kind of stuff.
Yeah.
And now I'm 2.5 years out. Mm-hmm. Now it's when I'm starting to make moves of okay, let's stop working here. Let's pick up more days here. Let's think about partnership here. That kind of stuff.
Yeah. I think it's, again, I love the strategy. I think very few are willing to do it because it's a lot of change. Monday you might be here, Tuesday you might be at a different place, and so a lot of people that feels overwhelming, but I think it can be a pretty enlightening process.
Yeah, I think it for sure can be overwhelming for someone who's not used to it, but our residency, the way it's structured, I was driving to multiple locations in residency, just how Baylor works. So I didn't really care about the driving, so I was, it was kind of less hectic than residency because I was going to a different clinic almost every day in residency, and here I have 3 offices, and my days are different, but
yeah,
the driving I didn't really care about, so that was an issue.
And the 3 different offices you were in, so I know, obviously I'm intimately familiar with one of your offices, Dr. Kuba's office, which is a primarily PPO practice with some out of network, as well, but more insurance driven is what I would say. No OR time at this office. We focus more on, sedations and IV. Talk about how, what were the different experiences and what did you kind of gain in each of those?
So that was Cuba's office is what you just described, and then one of my offices, which I started off working, like I would have considered this office my main office in the beginning because I was there consistently 2 times a week. But it was more of like a heavily Medicaid. I don't know the exact percentage, but it was almost every kid was Medicaid.
Yeah.
And then I didn't get OR access there because they had, more senior doctors there doing the OR consistently, and I was only there 2 days a week, so that doesn't make sense. So I was just doing like sedations and nitrous and, just your run-of-the-mill Medicaid stuff. A little bit higher volume, but nothing crazy. Because I've heard of some Medicaid offices that see like a lot, like some of my friends that, got out and started working, they would see like consistently like 60, however many, that kind of volume. And our office was not really like that. So it was kind of more of a chill Medicaid, but still, busy. And then my third office was like an hour away from me. So far out, kind of similar breakdown to Cuba's as far as like insurance cash, but they did see Medicaid, but it was like, I don't know how they did it, but it was like a very, very small percentage of Medicaid. And they didn't have OR time. But they did do like in-office general anesthesia, much like kind of Cuba does, like in-office IV. So that was that office. And the only kind of difference was it was in the country. So like the patient, I guess not the patient, the parents were so much different than like anything kind of by the city. And then Cuba's office.
Well, and now that you mention that, that's even an interesting point because each of your 3 offices were in very different locations as well. So it's like not only were you getting a different type of practice, but also a different demographic of patients as well.
Yeah, and I mean, it's just like city folk compared to like people that live out in the country. I mean, it's just a different thing wherever you go. And Cuba's subset of like, Irving is by Dallas, but it's not Dallas itself.
Yeah.
But Cuba's patient population, we just have like a very cultural one. So that's like very unique to like this like Valley Ranch area of Irving. Like it's just like very particular to this area.
Yeah.
Whereas the other office, like the kind of Medicaid office, is kind of had all different kinds of patients. It wasn't, like a regular like suburban kind of environment.
Yeah. So as you've gone through these last 2.5 years, I want to kind of speak to the practice owners that are out there. You've had, I would say, 3 successful associateships, and there's probably things that you appreciate about each of those and like about being an associate in that practice, and probably downsides.
Yeah.
So talk me through what makes a good associateship.
I think well, it just kind of depends on where you're coming out of, because I can speak to like a new resident as a new resident. So as a brand new resident, and I guess it also depends on your training, but coming out of residency, I was like, oh, I know the basics of stuff. I'm still, slow. I'm still slow today, but I mean, I was much, much slower back then. And I was like, I want a place where the owner doc is kind of like helping me a little bit, and I have some kind of mentorship, that kind of stuff, blah, 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 blah. So that was a big plus in the beginning. And really, I think I gained a good amount of speed from that like Medicaid office, not only because it's like higher volume and, high carries risk and you get more operative in general there, but that owner, he actually came, because I told him all this like when I was interviewing and stuff like that. And he actually came a couple days, and I never did like full mouth oral sedations in residency. Like that just wasn't a thing. I mean, I was way, way too slow for that. So I never thought doing full mouth sedation cases was even like a thing. And when I first saw him do it, I was like, holy crap, like you're super fast. And he was like, no, it's really doable. And then he kind of guided me and showed me, it's only a couple days where he like came and showed me, but I thought that was like super helpful and like really awesome of him to do. Where now I'm like, I don't even, if I can do a full mouth sedation, I'm doing full mouth sedation. Like I don't really think about it anymore because he set me up to like do that or like be comfortable doing that. So I really appreciated that. So I think in the beginning, that's what I was looking for as a new grad. But then once and again, this is all as a new grad, so I don't know if I was looking for a job now, obviously
Yeah.
I don't think any of this would apply because I'm looking for something totally different now.
Right.
But for all these people that are maybe looking at hiring new grads or whatever, I think, some kind of mentorship was important. And then after I kind of got the hang of the dentistry, because it wasn't just him, like, obviously Kuba helped me because I did IB cases for her, and like, I did zero zirconia stuff at the Medicaid place, and then she kind of like, there's, my first case of zirconia, she like was there,
Yeah.
like kind of holding my hand while I did it, because I did a handful in residency, but not nearly enough to be comfortable. So then, that kind of operative skill and that kind of thing, obviously comes with time. But once I kind of was comfortable with that, however many months or a year or whatever it was in, then I was, as someone who doesn't really know anything, I was like, okay, what can I learn now about parent management, insurance, running an office, that kind of type of thing. And so that's what I was really more interested in after that. But again, I don't know what associates are looking for, because some associates want to come in and they're just like, I just want to do my thing and get paid and go home.
Yeah.
Or in my mind, I was like, if I partner with somebody, awesome, but I want to be some kind of owner. So in the back of my mind, I was always like, oh no, I always eventually want to learn the business stuff. So that's what I was looking for.
Yeah.
So I guess it's just like what you're looking for.
Well, and I think that's really important, though, for practice owners to hear, because I would assume that most practice owners are kind of assuming that the associate will be here for a period of time and then either partner in or move on. I don't think that's 100% of the time, but I think it's the majority of the time. And just hearing from your perspective that that's something that you are seeking, is that people would actually allow you, practice owners would actually allow you to learn more about that, to ask questions, to coach you on things and mentor you on things, not just dental wise or clinically, but also even towards your goal of practice ownership.
Yeah, and I think it's, like my one boss from the Medicaid office, like he's very much business, like super, super smart about that kind of thing. I don't even know the stuff that he does, because he owns multiple offices. Like, it's not reasonable for him to come and hold my hand. Like, that's not what I'm looking for either. So in that office, I learned a good bit about Medicaid stuff from the office manager. Like, she was really helpful, and she was awesome about like explaining stuff to me and that kind of thing. Kuba I've learned absolutely the most from like Kuba's office, because as time has gone on, that's where I've become, like, that's where I've been the majority of time. And she's always talking to me about this and how this works and that works and how to, deal with this parent, any stuff like that.
Yeah.
And she's there because it's, she has the one practice and like she's there. So like, obviously she's going to be more able to help me. Then my third office in the country, it was owned by somebody, and we didn't have like much time, like working together, because I was really only there one day a week too. But then he ended up selling to corporate, so then it's like, that kind of boss type deal kind of, fizzled out. Like, I wasn't really gaining anything. Like, there's a couple other things I gained from that, but, I didn't really have like a boss there per se anymore.
Yeah.
But yeah.
Well, and again, I think just knowing associates, it's important for practice owners to kind of figure out what are your goals. What are, as an associate, what are you wanting to learn? How can I support you in that? How can I mentor you along your way? And I know that can be scary for a lot of practice owners, because they're like, well, I may mentor you right out of my office.
Yeah.
But at the same time, to me, it's more important for a practice owner to know that earlier on. And if your owners are like, great, what are your goals? And you're like, I would like to eventually own at some point or partner. Okay, now I know that. That's not scary. Now I can help coach you along that. And I think a lot of times we do the opposite as practice owners. We're like, oh, great, he's going to be gone at some point, so now I've got to shield everything and protect my business. And I think there's some protection that we need to have in place, but ultimately that shouldn't prevent a practice owner from mentoring and really investing in their associate.
Yeah, I think that's true, especially for my case. And I'm trying to think of like my co-residents in my class. Yeah, a couple of them have like partnered in. I don't know. In my mind, that's where I think people are wanting, is like some kind of ownership opportunity. But then, when I just listen to random stuff or look at the internet and stuff like that, I think there's also like people who like want associateships and that's all they want.
Absolutely.
But I feel like maybe those people end up working for corporate places where
Yeah.
they know that they can just show up and do their thing and then leave, kind of thing.
Yeah.
But I mean, I don't know. I'm not the expert on all that stuff.
Yeah. I think you're right. I think it's the minority for sure. I think the majority want some type of ownership. Not all by any means, but the majority do. And I think if practice owners recognize that earlier on with associates, they might do a better job of either considering that for themselves or at least mentoring you on in that direction without being afraid of it.
Yeah, and I don't know, maybe this is a better question for Cuba, but I feel like I don't think I was like handheld. Mm-hmm. Like, I hope I wasn't like a big burden on these people. I didn't think I was, but I don't think it's like super, if someone's out there thinking like, oh man, I gotta baby this associate forever, like, I don't think it has to be that. Like, you show me a couple times and then that's kind of it, and you kind of explain. I don't know. I just don't want people to think like, oh, we got to spend all this time into doing it, and now my production is lower because I'm just like babying him, which, the first month maybe, depending on the resident, if it's a new grad, but I don't know. That stuff is like, I don't really know how that works. I can only speak like on my case or whatever.
For the most part, when you think back to these offices that you've been working with, how did you initially, or how did they navigate incorporating you? Like, do you feel like there was one onboarding that was smoother than others? And if so, what made that particular practice smooth?
I mean, when you say onboarding, I think paperwork. So all the paperwork was kind of the similar everywhere. Yeah. As far as like jumping in, I guess it kind of depends. I mean, because in my situation, Cuba was I worked there like every other Friday to begin with. Like, I barely worked there, but I think the way she onboarded me to the public was like more smooth, because I think in her mind too, like, I was the person that was going to replace her old associate, so I was going to inevitably pick up more days. So like, it was, unless I turned it out to be a complete idiot, but like, I think it was in her best interest and my best interest to like, hey, we need to, slowly advertise this guy and like, make a post or, put him on the website, that kind of stuff. Whereas the other two offices, they kind of had a little bit of a system of like having associates kind of come in. So they were more just like, okay, jump in and,
gotcha.
The patients will figure out. There's not really a let's roll him out to the public kind of thing, where like that's what kind of Cuba did, is like rolled me out. And I don't know.
Do you feel like parent and patient acceptance was the same? Like, in Cuba's office, did parents seem more open and more willing to get to know you, more curious about you, or was it pretty much no matter the rollout, it was the same reaction?
I think that's a little tougher because of the parent demographics, because in the office that's an hour away, I don't really think it would have mattered if they rolled me out, because those parents the majority of those parents are, they're very easygoing and like, they're like, oh, new person, cool, like whatever kind of thing. Whereas Cuba's parents are not that at all. So like, I can only imagine what would have happened if Cuba didn't roll me out. Like, I don't think anybody would have like taken to me at all. The easygoing ones maybe, but like her parent population is a little particular, so that's why you kind of needed to roll me out to this population. And then the third office is a Medicaid office, so like a lot of Medicaid parents are happy that someone's seeing their kid and it's paid for kind of thing. So
pretty low expectations overall.
So like, I didn't really have an issue at those two offices.
I think that's helpful though, even talking through the three I can guarantee you there's people listening to this episode that have one of those types of practices and need to take into consideration the actual rollout plan for bringing a new doctor on. So, and that could be no plan at all if you've got a really laid back patient population or a Medicaid population. But if you've got particular parents, we've got to have a pretty clear plan.
Because if whoever's been coming to Cuba's office for this many years and then there's a new dude there, because Cuba, it's not like Cuba has like a rolling thing of associates. It's like it's always been her, and then one doc that comes and helps out here and there, and then the old associate that was there. So like it's only ever been 3. So if like a new random dude comes and I'm this tall 6'8" dude, and they're like, who the hell who's this guy?
We're used to little petite women around here, right?
So it's like I think it was the best interest for everybody to have like rolled me out the way they did.
And as far as incorporating with the team and all of that, getting to know your assistants and your hygienists and your business team members, do you have any suggestions on how to make that easier for an associate?
I can't remember what the role, for the other 2 offices there was nothing. I jumped in day one and it was whatever. At Cuba's office, I don't think there was a big rollout with the staff, right?
I'm trying to remember.
I know I came and shadowed a couple times, so like they're used to me a little bit.
To them.
So it's not like I just jumped in there day one and I didn't know anybody, because I probably didn't know anybody's name still, but I had seen them maybe 2 or 3 times when I shadowed in residency, and then towards the end of residency I was shadowing a little bit more. And then maybe before I got like my license actually came in, maybe I can't remember exactly, but maybe I shadowed another time or something like that, where at least the staff knew my face and it's just not some random dude or whatever. But I don't really know.
Do you feel like in each of those settings that you had kind of a point person, or at least somebody that you're like, oh, I got a question about XYZ? How did you know or navigate who to go to? And
at the one office, it was like the office manager.
Okay.
And then it was either Cuba because she's was there. Or the old associate. Or like the manager type person that's there. And then the faraway office, it used to be the owner, but then after he sold to corporate, but by the time he sold to corporate, I was pretty familiar with it.
Acclimated
so
at that point.
It was not a big deal or anything like that.
That's good to know too. So as you think about these practices, what are some of your favorite things that you've learned, either from systems that they have in place or things that they do well or don't do well? What are some of the things you've picked up on?
If I just break it down by office, which hopefully, I don't know if these people are listening or not, but whatever. Like the Medicaid office, like I said, like I really did gain like a lot of my operative like comfort level and like able to see a volume of patients or whatever from that, and I'm like super grateful to that boss for showing me how to do like full mouth sedations, because I don't really know how long it would have taken me to get there unless he showed me like that day one, and I was like, oh, this is super doable even for me, like that kind of thing. I guess the things I didn't like were, it's kind of, it's a Medicaid office, right? It's not like they have the greatest equipment. They're kind of on a budget's a bad word, but compared to the other 2 offices, like I could tell the difference in either hand pieces or like birds, whatever. It's just stuff like that where it's like day to day I was just like, oh man, I hate this hand piece, and like that stuff kind of was like, I'm not gonna go to the boss and be like, hey, switch all this stuff out for me when I'm working there 2 days a week, and I'm like, who cares about, like, it's not, I was just like, I'm just gonna do it, like it's not that big of a deal. But it's when you have other places to compare it to, then you're like, I'd just rather be there. Nothing against y'all have been doing it this way, it's been working. I'm not gonna come in and do whatever anyway. So that's that.
But again, I think for any practice owner listening to that, that's so helpful to know that something as simple as better quality, which makes your life easier, just day to day, you've got a handpiece that works really well for you, versus an office where it's not quality, like that can make a difference.
Yeah, I think in the back of my mind, because that owner would come to this office every once in a while, and I was like, if he's not complaining about it, I have no right to be. I'm just being a little princess right now. So like I was like, whatever, suck it up and just do it. But over the course of 2 years, then it's like, I just don't want to do this anymore. Like they can do their thing and keep it like that, but I'm over it, kind of thing. Yeah. It's not like I was mad about it, but I'm just like, why would I? I don't know.
When you have other options.
Yeah. It's like I like that office. It's just like, and I told them on my last day there, I was like, I really like it here, but I just have a better opportunity somewhere else, kind of thing.
And for you, navigating what do I want, if I want to own at some point the type of practice that I want, now you know.
Yeah.
Hey, there's a certain, if I'm only making so much because of the contracts that I have with Medicaid or other, and that only allows me to buy this certain type of equipment, that's not for me.
Yeah.
Long term, that's not for me.
No, and that's another one of the things, like in the beginning, I think in the beginning, right out of residency, I was like, I've been in school my whole life. Like, I really wanted to make money, and I was just like, oh, give me all the whatever. I was like, the more patients I can see, the better, blah, 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 blah. And it wasn't until, I don't know how much in, I started looking at insurance numbers and being like, holy crap, Medicaid sucks. Like, I have to work so much harder for this compared to, at Cuba's where it's, more PPO and whatever. And even some PPO sucks. But still, like, just exclusively doing Medicaid is like, oh man, I'm kind of busting my butt here when I don't really have to be.
Yep.
So again, what's the benefit of seeing Medicaid is like those people need to be seen. Like, it's like, somebody needs to see the Medicaid kids and all that kind of stuff. But I was just like, I'm just kind of tired. Yeah,
not for me.
Yeah, now I'm getting kind of burned out or whatever. Anyway, and that's the kind of story about that, because I think the main reason now that I'm saying it out loud, the main reason why I was like, I'm going to go to Cuba's more is because, insurance is a huge deal. But like, I have to work way less at Cuba's to,
make the same amount.
Yeah, pretty much. And then at the other place, the faraway place, I think I don't know. I just had like one instance with the old boss there, just about like the way I was paid and stuff like that. That we went back and forth, and then really I'm an idiot because I was doing this over text, and I realized like I shouldn't be doing this over text because I perceive messages one way, he perceives messages another way, and like it was just like a little bit of a, what's the word? Not drama's not a word, but anyway, just like disagreement, like / uncomfortable situation where I was like, oh, this is kind of weird.
Yeah.
But I was never mad or anything like. Anyway, moral of the story is if there's stuff like that, I would just much rather now just talk about it instead of text.
Yeah.
Because things get misconstrued over that. But that was pretty much it. After it got sold to corporate, nothing really changed. But now, however many months, or if it's been a year since it did sell, now I can tell for everyone or anyone that's thinking about selling to corporate, which this is just this is what I can speak to because this is what I know. But the big difference now, almost a year later, is I feel like I can tell that there's no real leadership there.
Yeah. And
a lot of the assistants are just like, well, no one's gonna, there's no, there is an office manager, and there's like a corporate manager or whatever, but it just feels different than it used to. Like before, there was one person who was the owner who made the decisions, and if you did something not that you weren't supposed to or whatever, he would get onto you and then you'd get reprimanded.
Right. But
now there's no, I don't know, just like a lack of a true leader like that, I guess. I don't know if that's a bad word.
That makes perfect sense to me.
Anyway, it's kind of like, it's not like the office is falling apart, but things are getting, like, I don't know, people are on their phones all the time, like no one's...
It's so lax
now.
It's
so lax, and it's like, I don't know, I'm there one day a week, so I'm like, I'm not about to fix these, like, I'm here one day a week, literally, like, this is not my problem, for lack of a better word. but it's just kind of, I don't know. I think it would do well if there was like one leader and like,
Yeah.
you know, an owner who like made decisions, that kind of thing.
That's, again, such a valuable perspective, because even if it is one day a week, you were there pre-corporate and there post-corporate, and to see the difference, I think that's incredibly insightful.
Yeah, and I mean, again, this is this one office. Like, I don't know
Yeah.
if this is consistent with everything, but that's just, I feel like, what I've seen.
Yeah. So it sounds like some good observations that I feel like you've made, and I think even hearing you talk through what did you like about this practice, not like, I think associates that may be looking for a good place for themselves, or practice owners, need to listen to those things. So taking it kind of more in the associate direction, like what advice, if you're back at Baylor talking to the residents that are about to graduate, what advice would you give them on how to find good associates? What should they be looking for?
The residents?
Mm-hmm.
I would say, I don't know. I feel like all this is like personality dependent too. But I would say if you can find, and I don't know if this is readily available, because I feel like it was like a miracle that I landed with Cuba. Because if you can find someone that'll mentor you like that, or give you kind of some kind of mentorship, you're an idiot outside residency whether you did a lot of operative or like, yeah, you if you did a bunch of work and you're like very comfortable in hand skills, you still don't really know anything about the outside world. Like, yeah, you might know the dentistry down faster than somebody from a slower residency, but like it still do you good to find someone who is at least willing to maybe give you a little bit of mentorship, not hold your hand per se, but, you know, do something. If you could find a Cuba, that'd, you know, be really good. Or if you're like coming from a residency where you're like, okay, we didn't do a whole lot of operative here, then maybe like my Medicaid type office is the place for you. Like, you can go there, and this sounds really bad, but like you can kind of like practice your dentistry and like get your reps up and get your numbers up, and then, you know, after that, then you can think about, okay, do I want to partner with somebody? Do I want to start my own? And, you know, now I have the dentistry down after however long, and that kind of thing. Or not even a Medicaid office, like a corporate place where like, you know, they're going to turn over, they have a high turnover of associates. So like you going there, because I think if my plan was, okay, I need 2 years to practice, Cuba would not be a good fit for me.
Right.
Because I'm not going to use Cuba, like she invested a lot. So like for me to use that as, okay, this is my 2 years of trying to get my speed up, that's not very fair. Whereas like a corporate office, I mean, it's still not fair, but I think a corporate office kind of has that contingency built in. Like I think they know they're not going to retain a whole lot of people for like a long period of time. So if that's what you're looking for, if you're like, hey, I'm a little bit weaker and not faster, then maybe go to those places.
Yeah. I think that's so smart though, to like do self-evaluation before you even think about the type of associateship that you're looking for, because, and that's one of the things that impressed me in one of our first conversations, is because you're like, I know I want to be in this type of office at least 1 or 2 days a week because I want to increase my speed. I know I want to be in a private practice because I want to experience the PPO world, blah, blah, blah. So you had a very clear idea of what maybe was a deficiency or an area that you felt like you hadn't experienced before, and you wanted to piece it all together so you could complete this almost like post-residency continued training, you know? And I think that's important as associates who might be graduating from a program and are going to be looking for an associateship, that they think through what are maybe the areas of deficiency that I have, and then go towards a practice that's going to help supplement that.
Yeah, for sure. And I mean, I had classmates who were like general dentists before. So like that's a whole, because I went straight through school. Like I never, like after college I went to dental school and then I went to residency right after. So I had like no real world experience. So like there are residents who have been a general dentist for however long, and I had those people, and they're very much more like some of those people went and just started a practice right out of residency, and like that works for them. Like there's no need for them to associate because they're like, I already did that game, like I'm done with it.
Right, good point.
I don't need to. They just need an associateship to kind of supplement their income while they're starting their own deal. So it's like, it's really just your situation dependent, I guess. And like, I think you just need to sit down and list like, okay, I'm looking for this and I need this. Now where are the places, that thing? And again, like I'm more of a proponent, unless you find like this like miracle job or something, like I'm all for like pick a couple offices and do a couple days here. I mean, that worked really well for me, so that's why I say that. But
well, and again, I think it was easier for you to pick the associateships because you knew what you were looking for.
Yeah.
So once you had met with multiple people, I think you and I even we talked before you started looking and then after, and you were kind of weighing pros and cons of which offices to pick. And to me, it sounded like it was pretty simple for you, because it's like, I know I needed reps and speed, and so I know I want this one. I know I want private practice, so I know I want this one. And then this third option, it could be this place or it could be this place, and here's the pros or cons of that. And so I think if you were trying to decide all of that without having thought through your goals ahead of time, it would be harder to pick.
Yeah, then you're just looking for a job, and it's like whatever lands kind of thing. And then you're gonna find out, but it's gonna be after the fact.
Yeah. No, I think that's excellent advice. Anything else you can think of that you would want to share with either associates out there or practice owners?
I don't know. It's open-ended question. No, I'm not good at those.
Anything you want Kuba to know, because she's going to listen.
Pay your associates much, much, much more, and they will be very happy. No, I'm just kidding. Please don't get mad at me.
Hey, she put you up to this, so you should be able to get some digs in, right? No, I really, again, I appreciate you being here. I love that you're the very first associate. We're going on 2.5 years of the podcast, and you're the first associate. So
beautiful.
I didn't bring your trophy that gives you the award for that, but just know that
I made it.
You made it.
Put me in the archives.
Hey, thanks again for being here.
No problem.
Thanks for joining the conversation today. We hope that you are comforted in knowing that you are not alone, but we also hope that you're walking away with some really great tips and tricks to try in your practice. We value your feedback, so please take a few moments to rate and review the podcast. Finally, we want to make sure that we're covering the topics that matter to you. So track us down on Facebook, Instagram, and Twitter, and let us know what topics you want us to cover. As always, please know that we are rooting for you today as you manage your dental drama.